Hi, everybody. Thanks so much for joining our webinar today. We appreciate your time. I'm going to apologize up front. We realize that the governor's press conference has now been shifted to 11 o'clock as well. Just know that this webinar will be archived and all registered participants will get a link to the archive. It'll also be posted on our webpage under the long-term care link. So you definitely could view this at a later time if you choose to sign into the press conference. Alternatively, the press conference is archived on Governor Reynolds' Facebook page. So I apologize again for having this conflicting time. We will change the time in the future as the governor's press conferences it sounds like they will be at 11 o'clock going forward. So we will shift the time of this webinar to make sure that we don't conflict in the future. So again, thank you for your patience with that. As with all of our webinars, we will be archiving them and sending those out. And like I just mentioned, posting them on the website. We'll also send out the slides deck that we use for this webinar, although we don't have a lot of slides that we're planning for today. Again, we just want to share updates with you, and then we'll have plenty of time for question and answers. So again, we appreciate your time. We know this is a really busy and difficult time for everyone, and just are grateful for you being able to dedicate some of that for this discussion this morning. We're going to give a quick update on COVID-19. We'll talk about recommendations for PPE in long-term care facilities. And then our preparedness partners will talk about some of the recent data requests that are coming through the regional medical coordination centers. We'll review the process for requesting personal protective equipment through your county emergency managers, and then we'll have time for a question and answer session. So at this point, I'll turn the discussion over to Dr. Padati, the IDPH medical director and state epi, to talk us through some updates on COVID globally and in Iowa.
Thank you, Dr. Garvey, and thank you to everybody, for joining this webinar and for all of the work that you all are doing, particularly when it comes to helping protect our most vulnerable population. We know that this has been a really tough time, and we're incredibly grateful to all of you for all the work you're doing, and we want to continue to work to support you as we move along. So I wanted to give just a quick epidemiologic update here for you. What you're seeing now is the updated World Health Organization dashboard. If you haven't seen it before, they've adjusted a bit how they're presenting some of their data and the way that you can interact with the data. Again, I think that what's nice about dashboards like this, or the Johns Hopkins dashboard, are that you kind of can see some of these trends over time, and these are receiving information from the various Centers for Disease Control or Ministries of Health throughout the world. And unfortunately, you can see, of course, that we've continued to have cases climb to over 1 million COVID reported cases worldwide and 64,000 deaths. Again, similarly in the United States, if you visit the Centers for Disease Control website, they continue to provide updates every day of the week around noon each day, and they're providing updates on case counts, and you can see the chloropleth map here that's showing some of the areas that have seen higher case counts, which I'm sure many of you are well aware of, including places like New York, New Jersey, Connecticut, Pennsylvania, Michigan, Louisiana, Washington, and others. And similarly, if you visit the Iowa Department of Public Health webpage, again, you'll see a similar chloropleth map here that's providing for you the case counts that we have here in the state of Iowa by county as those are reported to us. And those are going to be cumulative numbers. So, they're going to continue to go up even as we have people who have recovered. These will be reports of cumulative cases by county. Similarly, we're providing a little bit of information on gender as well as age categories and information on individuals who have been hospitalized. And when you look at some of the age category data, you'll see that, we do have, individuals in the older adult or elderly categories who are affected by this. You'll also see others in younger age categories that often are representing individuals in the healthcare workforce. So, healthcare workers who are helping take care of older individuals. and also including, other people who may have underlying conditions. So we continue to report out some of the age patterns. And we're also continuing to share information that we receive on individuals who are hospitalized. And again, you can see here we're sharing individuals who are currently hospitalized, those who have been reported to be discharged and recovering, those who were never hospitalized, and those who were deceased. And metrics like this are helpful for us to understand a little bit about the severity of the illness here in Iowa, and also a little bit about what our healthcare systems are experiencing and how they're being used to care for COVID patients here in Iowa. And again, this is information that you can find on our webpage and that we continue to update daily. I did want to share a couple pieces of information that you may have seen shared already around long-term cares in particular. More than 10% of all reported cases of COVID-19 here in Iowa are associated with long-term care, meaning they're occurring among staff and residents. And unfortunately, over 40% of all the deaths that we've seen reported here are among residents in facilities that have an outbreak of COVID-19. And I know that this won't be, surprising for anybody on the call, and it's of course, an incredibly unfortunate measure. But I think it's also important, as we all recognize, that the long-term care facilities that you all are working in are serving, again, our most vulnerable populations, and that we want to protect them and support you all who are taking care of them in every way possible. So I think to that end, many of you may have seen that we provided some guidance around personal protective equipment, in particular for individuals who are working in the settings, in long-term care settings that you're all in. And the idea here is that we want to encourage the use of a minimum level of personal protective equipment for all patient care activities. And that's going to include a face mask and eye protection for all patient care, regardless of whether individuals are ill or not. And we know that that's hard because we fully recognize that, PPE has been a concern. It continues to be a concern. And so you'll hear in a bit about sort of how we're keeping an eye on that and how we want facilities to request assistance if they need it. But again, we just want to make sure that we're being as supportive of you all and of the residents of your facilities as we possibly can be. And I think we're recognizing that, the transmission in facilities like yours can be really challenging. And so the best place to be on this is to be preventive. And so through the use of routine face mask and eye shield protection for patient encounters, we're hoping to really limit the introductions and spread of COVID-19 in facilities like yours. Now, that recommendation is similar to what I think CMS came out with, about a day later around the same time. And that recommendation does not change the overall recommendations for PPE that needs to be used for taking care of suspected or confirmed COVID patients in any setting. That recommendation is still that providers are using standard contact and droplet precautions with eye protection that will cover the front and sides of your face. And then you'd also want to be using a fit-tested N95 respirator or equivalent if you're performing aerosol generating procedures. That's going to include things like intubation, tracheal aspiration, or nebulizer treatments. I did also want to take a moment to acknowledge, I know that particularly now, a lot of different partners are asking you all for information. A lot of us are also providing guidance, and there's a lot of messaging, I think, coming to you from a lot of different areas, and we're trying as hard as we can to make sure we're all staying on the same page together, again, so that we can be, of most use and support to you all. And to that end, we are aware of the AHCA recommendations around transfer of patients from a hospital into a long-term care facility. And we have been working with IHCA, Leading Age, our hospital association, and our state hygienic laboratory to come up with some guidance for you around that. And we're going to be sharing that as soon as possible. So I think with that, I wanted to turn it over to Rebecca Curtis, who's going to talk to you a little bit about some of the information that we're asking for as part of our efforts to coordinate through our regional medical care coordination centers.
Good morning, everybody. As Caitlin said, I'll briefly introduce myself. My name is Rebecca Curtis. I'm the Bureau Chief for the Bureau of Emergency and Trauma Services here at the Iowa Department of Public Health, and working closely and directly with the regional medical coordination centers located throughout the state. So currently we are in the final stages of getting the last coordination center set up in Sioux City. So there are coordination centers now in Cedar Rapids, Iowa City, Council Bluffs, Des Moines, Mason City, and finally, as I stated, in Sioux City. The role of the Regional Medical Coordination Center is to make contact with the health facilities, particularly hospitals and long-term care centers throughout those regional areas, the service areas as we synonymously call them frequently. To work directly and gather data, baseline data for daily reporting, so we can utilize the data to make better decisions here at the department, to make decisions related to prioritization of workloads, prioritization of protective equipment, staffing, all of those other things that all of you may encounter as we work through this pandemic. So many of you may have already seen a letter at every single long-term care center in the state. As of at least tomorrow, we'll have received at least one letter making contact with the long-term care facility, requesting specific information. And I know that there has been questions come back through the associations asking if these letters and these people are legitimate. So we want to make sure that you understand that they are, and that we are working on your behalf. So the contacts are sent out via email first, and they will come from an Iowa Department of Public Health email address. So it will be rebecca.curtis@idph.iowa.gov. I can't believe I just completely blanked on my own email. But it will be, of course, the first and last name of the regional coordinator that's working out in those medical coordination centers. We will have that initial email will have two documents attached. The first will be just a baseline data information that we'll be asking from each one of the long-term care centers. We need to know from all of you what your 24/7 contact is for bed management, what types of staffing you use there in your long-term care center, what types of services do you provide there at your residential center, and then what's your supply chain look like, basically. The reason we're asking those baseline questions is so we know what a good day looks like for you. So then when we send you and ask you to do the daily updates on a survey, we know how to analyze the data and know when you're having a bad day. Then we know how to address it. We know how to look at your challenges. We'll ask you to rate your facility as green, yellow, or red. Based on those different factors related to the number of your daily census, the number of COVID patients that are currently in your residential center, the medical staffing pool that's available to you, and what your immediate PPE needs are. Now, I know that Dr. Padati and Ann both briefly touched on the question of protective equipment and what the expectations are for your staff for every patient contact. Again, acknowledging we know that that equipment is difficult to come by. So by assessing this information with you, having a good understanding of what your needs are, your priorities are, and then being able to direct you back to the appropriate people at the county level that your long-term care center is located, to the emergency management to make sure that those requests come through, that we understand that those resource requests, whether it be staffing or PPE, or any other resource that you're in need of, is recognized and filled to the best of our ability to make sure that your challenges are mediated as soon as we can possibly help you mediate them. So that's basically the RMCC in a nutshell. The PPE. So yeah, so again, as the regional medical coordinators reach out to you and we ask questions about your personal protective equipment, what levels you're currently working under and what your needs are, we will direct you back to your county emergency management coordinator at your county level to make those requests, and then we'll monitor on our end to make sure that those requests are being recognized and filled as timely as we can. And please just understand that we, again, are doing our best to fill those requests, and we are asking for emergency managers to submit requests for no more than what you need to get through for 7 days. But know that we may not be able to fill that based on the high needs and the high patient encounters that you guys are working on. So, but stay in close contact with your county emergency management. If you don't know who your coordinator is, shoot us an email, let us know, and we'll make sure that we send out the list of the emergency management coordinators and their phone numbers if we need to. So thanks for giving me some time, Dr. Garvey, and I'll be around to answer any questions you have about this.
So I think at this point we'll transition to Q&A. Please type your questions in the question and answer box on your screen, and we'll just work through those. The first one is for you, Rebecca. What if we haven't received a letter or an email from one of the coordinators yet?
The list that we have is currently in our EM resource. If you've been talking to anyone from the Iowa Department of Public Health, we should have your name. So if you don't get a letter at least by Wednesday this week, please reach out to us and we'll make sure that we get your facility on our list.
We have a comment from one of our association partners that says they've been advised by at least one county that the emergency management coordinator is refusing PPE requests from local nursing homes, stating that supplies in that county would only go to nonprofit providers. Can you advise on this issue? If that long-term care could reach out to us, 1-800-362-2736, we can definitely help work through that situation. That's not something that we're hearing commonly on our end. So if you are getting that kind of feedback, please just reach out to us at that number I just provided, and we can talk through the specific situation.
And then Dr. Garvey will let me know what that looks like, and we'll make sure our emergency managers are providing information that's related to who is eligible for that.
Okay. Is public health or CDC having staff wear PPE for all patients in their nursing homes, or for patients they isolate because they are new admits for 14 days? Mine is asking PT and OT to wear full PPE even though they don't have respiratory symptoms, they are just new patients. And we are recommending that as much as possible, our long-term care partners wear PPE for all patient encounters, regardless of symptoms. It's especially important with anybody who's got respiratory symptoms or fever, that they're wearing full PPE. So eye protection, face mask, gowns, and gloves. That's especially important for anybody with symptoms. And again, I'll just take this opportunity to remind everybody that if you have 2 or more residents or staff with symptoms, please call us and we'll walk you through the process of making sure we're testing as appropriate and taking steps to reduce the risk of transmission. Do all residents need to have a face mask when a caregiver comes in to assist, even if staff are wearing them and there's no respiratory symptoms?
Yeah, I think that's the CMS guidance that came out at the end of last week, is to have residents cover their mouth and nose, when people come in. And I know that a lot of this guidance, again, you're getting a lot of information from different sources. And I think that if we take a step back, what we're all trying to recognize is we know that this virus it moves very quickly in long-term care facilities, and it has very poor outcomes among the people who you guys care for. And so we're trying to think through every possible way that we can reduce the spread of this virus, particularly because, as I'm sure many of you have seen, there have been some more recent, papers and literature suggesting that there may be people who might be able to detect the virus in people who are either asymptomatic or pre-symptomatic. And so that's where this broader recommendation for using PPE in these higher risk settings is coming from. And we're trying to recognize all the possible ways that the virus could possibly spread, whether it's, from a resident to a healthcare worker to a resident, or between those, populations. And so, our recommendation is that at a minimum, using a mask over your face and, your mouth and nose, which is going to, prevent your secretions from going out, and then using a face shield or eye protection, which is going to protect other secretions from getting into your mucous membranes. That's the minimum we'd want to see for all patient care activities, but it would be wise to try and follow those, more conservative approaches, depending on supply and what you have available. And we know that for some people, they're not going to have sufficient masks, face masks, to meet all of that demand. And so we have provided guidance on our website for when and how to use some of the cloth face masks. And again, our preference is for you guys to all be using, actual PPE if you have it available. I think, thinking about whether you would or could use a cloth mask with a face shield would also be a reasonable backup.
And just to drive home Dr. Padotti's point there, if you do need to use cloth masks, you should be using that with a face shield, not with goggles. Goggles would not be sufficient. You need that full face shield. Kind of a question about gowns, and gowns has been an issue that's coming up quite a bit. We know that gowns are kind of hard to get right now, but certainly if you have the ability to use gowns with each healthy resident, that's great, but they definitely should be used with anybody with symptoms. As far as ways to kind of extend use of gowns, we do have some information on our site and on CDC's site about how to extend gown use. And so we'll add that link to our long-term care tab on our webpage so it's easier for you to access directly. Just yesterday, we did send out guidance for individuals who may want to sew gowns and donate cloth gowns that can be rewashed to different facilities. So there's 2 guidance documents that just got posted. One is for people who are sewing, and the other is for healthcare providers that would be potentially using these washable cloth gowns. What is the recommendation on when to use N95s versus surgical masks in order to optimize supplies?
Yeah, the recommendation is still that N95s, fit-tested N95s, should be used for aerosol generating procedures, so things like intubations, tracheal aspirations, and nebulizer treatments. I think that looking at the CDC guidance on how to reuse and extend the supplies that you have and how to prioritize them depending on which of those procedures you may or may not have to do, I think would be the way to approach it. And we've also got some guidance on our webpage about how to use, extended use or reuse of some of those products. But again, I think, looking at what your patient load is, what kind of care you provide, and what supply you have and what's reasonable, I would think about, how you can make the best use of your supplies using those extended use and reuse guidance.
There's a comment that there's a long-term care facility saying that once there's 1,000 cases in Iowa, they will not accept new residents or residents back who have spent the night in outside facilities unless they have a negative COVID test, regardless of symptoms. How do you suggest my hospital handles this?
Yeah, so I think this is also sort of getting back to some of what we mentioned around the guidance for transfers. And we're going to work with people on coming up with a reasonable plan around that. And I think that, again, when we look at the big picture, I think we all agree that we want the same thing here, right? We want patients who need a higher level of care to be able to get it. So we got to free up the healthcare resources for when it's needed, but we don't want to introduce infections into long-term care facilities. And so we want to use as many precautions as we can. And so we're going to work to come up with some guidance that might be helpful for you. And I think I would also keep in mind, and I know this whole thing has been very hard, but even as we've had increasing total numbers of cases, we've also seen an increase in the number of people who are recovering, right? So that doesn't mean that there's, 800 actively ill patients at this point. So we are seeing some people who are recovering from this, which is good. So there's not a single magic number in terms of case counts. I think it's more about, the activity that we see and the resources that we have. And again, we'll work on some more, particular guidance that I think you can point to that might be helpful for that. But we all want to make sure that we're just getting patients the right level of care that they need.
So the next question is, providers who are admitting residents from the hospital who are post-COVID, what does post-COVID actually mean and what type of precautions are required? So I think what we're getting at here is someone who was diagnosed with COVID in the hospital. We would want you to continue to use the PPE that we've been discussing. We would want you to also isolate that patient until at least 7 days after their symptoms started, and that they've been fever-free for 3 days at least. And we know that some of your residents may run a fever for a longer period of time, so that might be longer than the 7 days, and their symptoms should be greatly improved. So that's the guideline that we're using.
And if somebody has clinically recovered and has met that criteria, we would have you treat them just like everybody else, which would be the minimum, at minimum, a face mask and eye protection, face shield, so we'd have you sort of treat them the same way as everybody else.
What are the recommendations for new admits that come from a congregate setting?
Yeah, I think, again, this is getting at some of those questions around how to help our patients move most effectively between long-term care and other clinical settings. And I think as much as possible, facilities should be thinking through whether they have designated rooms or wings or an area where they can help people who have come back from another setting transition back for a period of 14 days. And it's helpful if you have designated space and designated staff to do that. Now, we know that might be hard for some facilities, but I think thinking about how we can do that in a safe way would be good. And then again, we're also going to continue to sort of work, on ways to give you some more guidance on how to do those transfers safely.
I saw guidance that anyone who works at long-term care and another healthcare facility should wear a mask and eye protection when they go to the other facility. Can you explain why eye protection?
Yeah, I think we're just recognizing that there's really a minimum level of PPE that we'd like to see workers in these higher risk settings using, because I think that we recognize, some PPE is to protect the person, who's wearing it from getting sick, and some PPE is to protect the person who's wearing it from getting others sick. And we want to make sure that as much as possible, we're addressing both of those issues because we've recognized continued spread of this virus.
If you're not a direct care worker, do you need eye protection?
No, the recommendation is for individuals providing direct patient care.
If cloth mask, then face shield, is that for any time you are with a resident or just those that have respiratory illness or COVID positive? So we would recommend, if possible, that you use that for all patient care in your facility. Is there guidance on homemade face shields that we can provide? I know, go ahead.
I don't think that we have guidance on the homemade face shields posted, but there are other places that have that available. For example, I actually think the NIH may even have a pattern that they've made publicly available, but we can see if we can get that information posted for you.
If we don't have face shields and can't get them commercially, there's two parts to this question. So if you don't have face shields, we would recommend that you reach out to your emergency management coordinator, like Rebecca discussed, to see if that would be possible to procure for you. Then the question is, why are we making this recommendation when we know that PPE is in short supply? And I think Dr. Badati really covered that well when she talked about the fact that we're seeing a good proportion of our cases in long-term care residents and staff. We're also unfortunately seeing a high proportion of our COVID-related deaths associated with long-term care residents. And so we know this is a vulnerable population. We know that you're working with a vulnerable population, and we just want to make sure that we're recommending everything we can for you all to stay safe and to prevent transmission to your residents. We have emails from the Iowa Health Alert Network asking for PPE counts. However, there's only option 1 to state the message was received. Are these the emails that we should be looking for? So Rebecca kind of talked through this process. She's going to come over and talk on.
Iowa Health Alert Network asking for PPE counts. We're not going to be sending those out anymore. You would have received those previously, but we're not going to send those out any longer. The contact will be directly through the RMCC for that baseline information and then for the daily surveys.
A question about, can nursing homes receive or can they request COVID testing kits from the emergency management? So those kits can be requested directly through the state hygienic laboratory. There are some restrictions on the number of kits that you can request at one time, but certainly you can do that directly. I'll just stop my share here and show you how to do that. All right, you should be seeing a Google screen. We'd recommend you just go to the State Hygienic Lab website. It's just www.shl.uiowa.edu. You can get there a number of different ways. I always just click on order a test, and order clinical kits is the top link there. And that will take you to this web page where you can just enter your facility information. The type of kits that you want to order is virus isolation and detection kits. And you can order, those are numbers that I've ordered in the past. You can enter the number that you want there and request those kits, and they'll be sent out to you. Previous guidance suggested that once you have a positive case within your facility, you should isolate residents to their room. With the rapid spread in the state, would it be advised to do this preemptively? Yeah, it would be a good idea to isolate your residents in their rooms and do things like cancel the group activities, serve meals in their rooms. Those are all things that you should be thinking about right now, even without confirmed cases in your facility. Should hospice coming into your facility wear full PPE or just a face mask and shield? I think it depends on the kind of care that they're giving and whether they're caring for patients that have symptoms of fever and respiratory illness. So if they are caring for patients with fever and respiratory illness, we definitely would recommend the full PPE, and as much as possible, they should wear PPE for other patient care. Getting N95s are tough right now, but who does fit testing? Are there certified people for that? That would be a good question for your emergency management coordinator. They would be aware of resources in your county that could provide fit testing assistance for you. We understand that this is a vulnerable population. We understand the reason, but there is still only so much PPE available.
Yeah, we appreciate that, and we know that this is hard, and we know that it's going to continue to be hard. We want to hear about what your needs are. We want to help you, make the best use of what is available, and we just want to make sure that we're doing, as much as we can to help protect you all and the people that you're taking care of. But you're right, we know this is a challenge.
What is the recommendation for staff working in more than one facility? Is this okay? And so again, Dr. Padati kind of touched on this. If you've got staff that are working in more than one health facility, certainly if you've had cases of COVID in your facility, we want to make sure that that staff is wearing full PPE at any other healthcare facilities where they're working. We have not prohibited staff from working at multiple healthcare facilities.
As long as you're well.
As long as you're well. So We've gone over this information on previous webinars, but I'll just take a minute to show you where the guidance is for essential workers, which we consider long-term care facility staff to be. So if you just go to our main page, you can click on long-term care. Excuse me. Click the wrong one there. Isolation guidance for essential personnel. This talks about our recommendations for people who have been exposed but are still well, and our recommendations for anybody who's got symptoms. So if you have a staff person who's got fever and respiratory symptoms, we would recommend that you consider that to be potentially COVID, fever or respiratory symptoms, potentially COVID, and abide by these exclusion recommendations. So at least 72 hours fever-free and at least 7 days since the symptoms started and all other symptoms have improved. So that's a resource that's posted on our webpage. Last webinar, I went over some of these other links here, but certainly we'd recommend you take a look if you haven't done that so far. All right, we do not have any other questions in our Q&A. I'm switching over to the chat box. I see two comments over there. The first is, should face shields be assigned to one person to wear, or is it okay to disinfect and share? How long is a face shield considered good? Residents are getting together on their own in groups of 4 to play cards. Should this be discouraged? So yes, for the card playing, we really think it's important during this time to keep residents isolated from each other, again, because of the high-risk nature of those individuals. So we would discourage any kind of commingling. The other portion of your question, how long is a face shield good? I think that's a little tough to answer, but basically once it starts like getting broken, if you're no longer able to clean it, those are things that are good indication that the face shield should be disposed of and a new one should be used. We absolutely would say it's okay to disinfect those face shields. You should be doing that so we can extend their use. And if possible, it's best to assign those face shields to each person and then disinfect as needed throughout the day. The next one is, if employees are using cloth masks during their shift, did you say use a face shield as well? Yes, we did. And then the last one is, can we still have CNA classes with less than 10 students in the facility? Let us follow up on that. We want to make sure, there's a lot of other partners that play a role in those types of decisions, and we want to make sure that we're on the same page. That's not a question we've received before, so thank you for that, and we will follow up. All right, those are all the questions that we're showing right now. Again, we greatly appreciate your time today. We hope that this has been helpful information for you all. Please don't hesitate to reach out if you've got questions or issues. We want to support you any way we can. So thank you for all you're doing.